Hello. I'm trying to get the camera adjusted, and it's going to take me just a minute. Sorry you're seeing me with no makeup or anything, but I have been very busy trying to get some notes prepared for our first YouTube lecture. You guys are in trouble. This lecture note, at least what I printed out on paper, is 6 pages. So, I don't know how much of this I'm going to be able to say, but I'm going to try my best. First of all, I'm going to start with Chapter 1, lecture notes, and I thought the opening statement from the textbook was quite interesting because, and I kind of put it in my own words, but it seems that our thoughts and ideas about health, disease, and the healthcare system are undergoing significant changes in the United States, of course. Many people are beginning to understand that they must take a more active role in maintaining their personal health and that they cannot continue to rely on the medical professionals to always make them well. What has caused this change? Escalating medical costs, lack of health insurance, and disabling conditions with no current cures. It's hard to say. Our Chapter 1 starts out with the whole idea of the preventive health concept. And basically that means the emphasis is on the importance of being responsible for your own personal well-being. Preventative health practices in which one can do is follow a nutritious diet plan, keep immunizations current, wear seat belts, practice good oral hygiene, go to the dentist, folks, proper hand washing, avoiding substance abuse such as tobacco, alcohol, and drugs to cope, limiting sun exposure, and seeking early treatments for illnesses and injury. Preventative health measures that we can do as citizens in as a whole in our country is regulating vehicle emissions, food safety standards. We can be advocates for that. We can be water fluoridation, measuring air pollution and pesticide use, providing immunization programs, and being an advocate for child safety legislation. All of those last items have to do with something we can be advocates for as far as preventative health measures that will affect us as a society. Problems that are often encountered with preventative health issues or that prevent preventative health: poverty and homelessness, lack of food, no access to medical or dental care, adverse effects of media advertising, substance abuse, air and water pollution, and unsafe neighborhoods. Also in Chapter 1, it discusses some national preventative health initiatives, and there are several. Healthy People 2020, and if you'll look at Table 1-1 in the textbook, it gives you an outline of that health initiative. There's the National Children's Agenda, the Children's Health Insurance Program, Healthy Child America, National Health and Safety Performance Standards for Children, and that's also a table that I'd like for you to check out. It's Table 1-2 in our textbook, and we'll be talking a lot about those standards because, that's what you all are learning how to, or what it takes to work with children in the early child care setting. And we are going to be talking about the national rules for health and safety. We have been focusing this week on our state rules, which is why I had you do the assignment from the Georgia decal right from the START website. Again, back to the preventative health initiatives that are going on in our country today. No Child Left Behind, Coordinated School Health Program, National Children's Study, and the Let's Move initiative, which was established by the First Lady, Michelle Obama, in 2010. Basically, health plus safety plus nutrition equals well-being. Each of the three, health, safety, and nutrition, are all intertwined and dependent on each other. So even though the main emphasis this particular week is health, we are still talking about, like I said, there will be issues that come up that deal with safety and nutrition along with health because, like I said, each of these are intertwined. What is health? Well, the past definition of health is the absence of illness. The contemporary or more modern definition is a state of physical, emotional, social, economic, cultural, and spiritual well-being. And once again, there is a graphic in the textbook, and right now my computer's sitting on my textbook, so it'll make my camera a little bit higher. So I'll have to point out that particular graphic. It looks like a color wheel, but it goes along with what I just talked about, the contemporary definition of health. Okay, we are focusing on children's health for our discussion because we are early childhood and care learners. We're learning how to we're learning about this program and how to work with children in a child care setting. Children's health development and opportunities for learning are often influenced by both positive and negative experiences. And an example of that is, of course, an example of a negative experience is one that a child cannot, it's something that they cannot control. Children growing up in a poor urban neighborhood may be at a greater risk for becoming obese because they have fewer safe places for outdoor play and limited access to fresh fruit and vegetables. So that's a negative impact for children. We'll be trying to think of some other potential negative impacts that prevent children's from being healthy, as well as positive experiences. All right. Factors that influence children's health. Now, these are factors that we cannot change. Obviously, heredity. There is a great chart on pages 16 and 17. It's called Table 1-3 on growth and development, and it talks about the different milestones that you will see from birth. And like I said, my book's sitting on my computer, sitting on my book to make my camera higher. But I know it starts at birth, and I'm not sure. Typically, early childhood is birth through age 8. Our children are, by heredity, predisposed to certain health problems because they inherit those from their parents. We inherit heart disease, the predisposition to have diabetes, problems with vision, hearing, and the list goes on and on. We are a part of our genetic material, our genes. But in addition to heredity being a factor influencing a child's health, so is the environment. And an environment can impact one's health both negatively and positively. And I gave you an example a few minutes ago of a negative way it impacts a child's environment. Okay, another negative way that children are impacted in their environment is bullying. And in our textbook, again, my textbook is busy, there is a section on bullying, specifically cyberbullying. It is a purple box at the top of the page, and I would like for you to look at that because cyberbullying is kind of an issue, of course, that is relatively new because of the fact that we have more access to social media. But it is something that is serious, and it's something that's happening to our children at various ages. Um, Children's health that require special adults' attention, um, safety and injury prevention, body mechanics and physical activity promotion, oral health, brain health, and mental health. And in the mental health category, I'm talking about self-esteem, social, emotional competence, and resilience. Those are things that adults are needed to help children to acquire an overall wellness, sense of wellness, and good health attitude. On the opposite end of that is toxic stress, and again, I mentioned bullying and cyberbullying, childhood depression, childhood fears, poverty, homelessness, violence, and media violence. And our children today, unfortunately, are exposed to a lot of media violence, even through our game systems, etc. So I've talked about both positive and negative ways that adults can be in control of impacting a child's health, both positively and negatively. Again, those are an adult needs to intervene for safety and injury prevention, body mechanics and physical activity promotion. That's promoting physical activity, teaching a child how to ride a bicycle, for example. Adults going to need to intervene to make sure a child goes to the dentist, that the child takes care of their brain by wearing a helmet, for example, when they're riding a bicycle. And an adult needs to intervene with overall mental health by promoting good self-esteem, social emotional competence, and resilience in children. On the other side, adults, and not necessarily parents, this can be adults, people in the media. Unfortunately, we have people today that are stars, football stars, sports stars, basketball, and people, that are not influencing our children in positive ways, and therefore some negative ways that children are impacted by adults is toxic stress, bullying, childhood depression, childhood fears, poverty, homelessness, violence, and media violence. Okay, I'm at the top of Chapter 2. Chapter 2 is a quick chapter, and I may have to stop in between and finish up the rest of Chapter 2 on another YouTube. Chapter 2 talks about high-quality programs, such as in our state we have the Georgia Pre-K program. We also have Head Start, which is a federal program. Both of those programs understand and promote the connection between a child's health, their growth and development, and their ability to learn. Children's health affects their ability to learn, as well as their energy level and ability to focus. Each of these programs promote wellness by monitoring and assessing children's health by making referrals, maintaining safe learning environments, providing health education involving families, and serving nutritious food, just to name a few. Chapter 2 talks a lot about daily health observations, daily health checks. I have not worked in my background, I've worked for the public school system, and I've also worked for the 9th District. Opportunity is the name of that organization. Neither of those organizations require that I do the daily observational health check exactly like the textbook explains. I am not sure that is a requirement that you sit down with a child one-on-one with a checklist each day, but typically the observations that you do are, just what you see when a child walks in the door each morning. But teachers are there. Teachers do observe children. A lot of times teachers might see things that other adults don't see just because they do spend a good bit of time, about 8 hours a day in the public school system with each child. And it is essential that teachers do make good observations and they promote positive health, preventive health, and they provide information that is useful for identifying changes in a child's health status and developmental issues or problems. Um, I'm going to continue talking about this topic because I'm running out of time. I can only do so much on a YouTube video. So the part 2 of health, chapters 1 through 3, is coming up.